My name's David Bradley and I'm Chief Executive of South London and the Maudsley Foundation Trust. During the pandemic, our staff worked really hard to find different ways to help service users and their carers. And what we thought would be great would be an exhibition to really capture some of those moments. And this is a result of it. So I'm really looking forward to seeing the exhibition in the long corridor at the Maudsley.
I'm Rebekah Gray. I'm the Chief Executive of Maudsley Charity. We're a charity that works really closely in partnership with South London and Maudsley NHS Foundation Trust. And so we're already very acutely aware of all the work that goes in day to day in providing care and the commitment of NHS staff and volunteers. I don't think there was ever a point where that was more apparent than during the pandemic. And this exhibition shines a light into some of the aspects of care that are often not seen by the public, but are absolutely crucial to making sure that people who've got experience of mental illness get the care they need in the way they should, even when we're in very, very challenging circumstances.
My name's Jenkins and I'm Cancer Response Team Leader. The fact that we could continue to care despite this thing that had come into our lives, I think we're very proud of that and very thankful for that, really. But at times it was scary. Can we keep safe? Can we keep our patients safe? Is this okay? So lots of uncertainty. My team are just really amazing, and they have been so brave and they have pushed through. We're still here, and I don't think we should underestimate the impact, the sacrifice that the team has made.
My name is Jamal John. During the pandemic, my role changed from a tobacco dependence advisor to a physical activity coordinator, to take patients from the ward down towards the garden to do some physical activity, which we had the privilege of an outdoor gym and an indoor gym facilities. It was a very difficult time for them. Family weren't allowed to come onto the wards, they weren't allowed to go out on leave, so they couldn't ideally get the fresh air that they needed, and it was hard for them to get the support straight away. I'm quite an upbeat person, so during the pandemic I just wanted to get to work, help the patients, and day to day I like to be quite interactive and mix with people. It was mainly my family and my partner who was quite worried about me, so that's what hit home for me.
My name is Lorraine and I volunteer for SLAM. During the pandemic, I was delivering mobile phones or whatever was required by the voluntary services. And I also was working remotely, contacting clients and just encouraging them that while they're going through this restrictive period in their lives, that they've got support, and I'm there with a lot of care. I'm also a service user of Maudsley, that even in that, that's what was encouraging me to get up each day, knowing that it's not just about me. By me reaching out and touching, moving and inspiring others, I also was being given such hope.
My name is Rory. I'm the Deputy Lead in the Staff Support Team. My main role is to facilitate spaces where staff would come and process the emotional impact of the work that they do. When the pandemic hit, we had to put additional support for our staff in place. I experienced loss myself. I lost my younger brother. My sister, who was pregnant, ended up on a ventilator and had an emergency C-section. Luckily, both of them survived. I was quite moved by the support of my colleagues and my friends within the organization, and they helped me get through what was a very difficult time. I wasn't the only one losing a loved one. A lot of my colleagues lost loved ones, yet they were still pulling together, coming into work and supporting their colleagues and the patients.
I just want to say a real thank you to everybody that worked so hard during this time. You all made a massive difference, so thank you.